that this cancer is one of the most difficult to detect in time, often manifesting only when it is already advanced. But what if I told you that your body, in its innate wisdom, sends you signals, little whispers that, if you learn to listen, could be your salvation? Most people ignore these signs, attributing them to stress, age, or poor digestion. But the truth is that these minor issues could be your pancreas's first cries for help. Why is this so important? Because unlike other cancers, pancreatic cancer has no recommended routine early detection test for the general population. Your diagnosis depends on your ability to recognize these subtle changes and act. Imagine being able to detect such a serious threat before it's too late. This isn't just a matter of cure, but of quality of life, of autonomy, of continuing to enjoy your loved ones without the shadow of a devastating disease. A study by the National Cancer Institute revealed that early diagnosis of pancreatic cancer, while rare, can increase the 5 year survival rate by 20%. This figure, though it may seem small, represents lives saved, stories rewritten. So, what are these hidden signs? Why are they so easily overlooked? And most crucially, how can you, the best advocates for your own health, learn to identify them and take action? Stay with us because we are going to uncover 8 surprising symptoms of pancreatic cancer that you might have never imagined. If this video resonates with you, if you feel this information is valuable, please support us. Give this video a like, share it with someone you think needs it, and subscribe to join our community in the quest for vibrant and conscious aging. And of course, let me know in the comments what city you're watching from and your age. I love reading your stories and connecting with each of you. Keep watching until the end because the last sign is, without a doubt, the most unexpected and the most underestimated. You won't want to miss this vital knowledge. 1. Jaundice. That yellow tone that isn't just in the skin. When most people think of jaundice, they picture skin and eyes as yellow as a ripe lemon. And yes, that is a classic sign, but here's the secret. In the early stages of pancreatic cancer, this coloration can be incredibly subtle, almost imperceptible. Don't expect a bright, obvious yellow. It might begin as a slight golden hue in the whites of the eyes or a slightly dull, yellowish complexion that could be mistaken for a bad night's sleep or fatigue. This happens because the tumor, often located in the head of the pancreas, can block the bile duct, preventing bile from flowing into the intestine and causing bilirubin, a pigment in bile, to build up in the blood. But jaundice goes beyond the skin. Pay attention to 2 other silent indicators: dark urine and pale stools. Imagine your urine turning a dark brown color, almost like concentrated tea, even though you are well hydrated. This is bilirubin being eliminated by the kidneys. And if your stools, instead of being brown, become a light gray, pale, or even clay colored, and they may seem to float or be greasy, that's another key sign. This indicates that bile and pancreatic enzymes are not reaching the intestines to help digest fats, causing the stools to have an oily appearance and an unusually strong odor. A study by the American Cancer Society highlights that dark urine is sometimes the first sign of jaundice people notice, even before their skin turns yellow. Do not dismiss these changes, no matter how subtle they may seem. If this surprises you, say in the comments, "I never thought of that." And share if you have noticed any of these changes in yourself or your loved ones. Awareness is the first step. 2. Inexplicable and persistent itching. Now, here is a symptom that almost no one associates with pancreatic cancer, which is why it's so deceptive. Generalized skin itching without any apparent cause. We are not talking about itching from dry skin, an allergy, or an insect bite. This is an itch that is felt all over the body, often without any visible rash, and that does not go away with moisturizers or standard antihistamines. This itching is a direct consequence of the buildup of bilirubin in the skin, the same substance that causes jaundice. When bile flow is obstructed, waste products accumulate in the bloodstream and get deposited in the skin tissues, causing this intense and persistent irritation. Imagine the frustration of feeling this constant itch that wakes you up at night, that distracts you during the day, and doctors cannot find the cause at first. It is a symptom that is often misdiagnosed as a minor dermatological condition, delaying the discovery of the real problem. This itching can be especially bothersome on the palms of the hands and the soles of the feet, but it can affect any part of the body. If you have been dealing with unexplained itching for weeks or months that doesn't respond to typical treatments, and especially if it is accompanied by any of the other symptoms we will mention, it is imperative that you seek a thorough medical evaluation and not just a superficial treatment for the itch. Remember, your body is speaking to you, and sometimes it does so through an unusual irritation. If this seems like a revelation to you, leave me a comment with a scratching emoji to let me know this point made an impact on you. 3. Unexplained changes in appetite and weight loss. This is another symptom that, while seemingly simple, hides a complexity that allows it to go unnoticed. Unexplained weight loss and a lack of appetite are incredibly common in pancreatic cancer, but they are rarely attributed to this disease in its initial stages. People, especially older adults, tend to think it's normal to lose some weight with age or that they are eating less due to stress or mild indigestion. But this isn't just any weight loss. We're talking about a significant decrease in body weight, more than 5 to 10% of your weight in 6 to 12 months, without you dieting or increasing your physical activity. The reason behind this is multifaceted. The cancer consumes a lot of the body's energy, and the pancreas, not functioning correctly, may not produce enough digestive enzymes. This makes it difficult to absorb nutrients, leading to silent malnutrition. Furthermore, the tumor can press on the stomach or the duodenum, causing a feeling of early satiety or nausea after eating, which further reduces food intake. Imagine eating just a few spoonfuls and feeling completely full, or experiencing a sudden aversion to foods you previously enjoyed. It's a feeling of deep fatigue that isn't relieved by rest, a lack of energy that drains you even during the most basic tasks. If you notice your clothes getting bigger and bigger without trying, or that food simply doesn't appeal to you like it used to, it's a major warning sign. Don't just attribute it to age. Your body is telling you that something fundamental is out of balance. If you've ever lost weight without trying, let me know in the comments how much and what you thought the cause was at the time. 4. Persistent indigestion and changes in stools. Indigestion is such a common symptom that almost everyone experiences it at some point. But when it becomes a constant, a nuisance that is not relieved by antacids or the usual dietary changes, it should set off an alarm. We are talking about a feeling of heaviness, bloating after eating, excessive gas, recurring nausea, and sometimes vomiting. These symptoms are often confused with gastroesophageal reflux, gastritis, or irritable bowel syndrome. However, in the context of pancreatic cancer, these digestive problems arise because the tumor can block the passage of food or, more crucially, prevent the digestive enzymes produced by the pancreas from reaching the intestine. When the enzymes are not present to break down fats, very characteristic changes occur in the stools. Besides being pale and greasy, as we already mentioned, they can be bulky, difficult to flush, and have a particularly foul odor due to the undigested content. Unexplained and persistent diarrhea or constipation can also be signs. Think of chronic diarrhea that appears for no apparent reason or constipation that doesn't yield to laxatives. The World Health Organization points out that chronic indigestion, especially if accompanied by weight loss or jaundice, is a reason for thorough investigation. Do not settle for a superficial diagnosis of dyspepsia if the symptoms do not improve. Your digestion is a mirror of your internal health. If you've had persistent digestive issues, what was your experience and what advice were you given? Share it in the comments so others can learn from your journey. 5. A new diabetes diagnosis or a sudden worsening. This is perhaps one of the most surprising and least associated symptoms with pancreatic cancer, but it is crucial. The pancreas is the organ responsible for producing insulin, the hormone that regulates blood sugar levels. If a tumor develops in the pancreas, it can damage the insulin producing cells or interfere with their function, leading to a new diagnosis of diabetes or a sudden, unexplained worsening of a pre existing, previously well controlled diabetes. Imagine you have had type 2 diabetes for years and suddenly your sugar levels inexplicably skyrocket, or you need to drastically increase your medication. Or worse, you have never had diabetes, and suddenly, in a routine checkup, your glucose levels are dangerously high, and there is no obvious reason like changes in diet or lifestyle. A study by the American Diabetes Association found that up to 80% of patients with pancreatic cancer develop diabetes or experience a significant worsening of it before their cancer diagnosis. This is because the tumor not only affects insulin production, but can also release substances that cause insulin resistance in the body. Therefore, if you experience excessive thirst, frequent urination, fatigue, or blurry vision that cannot be explained by other causes, and especially if this comes with a new diabetes diagnosis, it is a sign that requires urgent and pancreas specific medical attention. It's not just high sugar, it could be much more. If this connection astonishes you, write pancreatic diabetes in the comments. 6. Abdominal or back pain that radiates. Pain is the most common and expected symptom in many types of cancer, but in pancreatic cancer, its presentation can be misleading and often delayed. The abdominal or back pain associated with pancreatic cancer is different. It's not a sharp, stabbing pain at first, but rather a dull, persistent ache that is located in the upper abdomen, just below the ribs, and that often radiates to the back. What is most peculiar is that it can worsen after eating or when lying on your back and may be slightly relieved by leaning forward. This pain occurs because the tumor is pressing on nearby nerves or adjacent organs, or in some cases, invading them. As the tumor grows, this pain becomes more intense and constant, but at first it can be intermittent and easy to dismiss as muscle pain or indigestion, especially in older people. The back pain is so common that this connection is often missed. Think of a pain that doesn't improve with rest or common pain relievers, a pain that interferes with your sleep or daily activities. If the pain is located specifically between the shoulder blades or on the bra line in women without a clear musculoskeletal cause, it is a sign that must be investigated. Do not ignore persistent pain, even if it is not severe at first. Listen to what your body is telling you. Have you ever experienced unexplained pain that led you to a doctor? Share your experience in the comments. 7. Unexplained blood clots, deep vein thrombosis. Here is a symptom that is so unusual that most would never connect it with cancer, let alone pancreatic cancer. The formation of blood clots, especially in the deep veins of the legs, deep vein thrombosis or DVT, or even in the lungs, pulmonary embolism. DVT manifests with swelling, pain, and redness in one leg, while a pulmonary embolism can cause shortness of breath, chest pain, and a cough. What is surprising is that in some cases, the appearance of recurrent or unexplained blood clots can be the first and only sign of an underlying pancreatic cancer. This is because pancreatic cancer, like other types of cancer, can make the blood more prone to clotting. Cancer cells can release substances that activate the body's clotting system. Imagine being an active, healthy person and suddenly developing a clot for no apparent reason, without a long trip or prolonged immobilization. A study from the Mayo Clinic suggests that unprovoked DVT is a warning sign that should be investigated, and pancreatic cancer is one of the hidden causes to consider. If you have experienced a blood clot without an obvious cause, and especially if it is combined with other symptoms from this list, it is crucial that you seek a comprehensive medical evaluation. This is a major warning sign, a true red flag. If you find this shocking, put clots alert in the comments. 8. Depression, anxiety, and unexplained mood changes. This is the most surprising and often the most tragic symptom because it can go unnoticed even by healthcare professionals, being mistaken for mental health issues or life stresses. The onset of severe and unexplained depression, anxiety, or mood changes, especially in individuals with no history of mental health problems, can be an early sign of pancreatic cancer. We are not talking about occasional sadness, but about a deep depression, persistent apathy, difficulty concentrating, extreme irritability, or a complete loss of interest in activities you once enjoyed. The connection is not fully understood, but it is believed that pancreatic cancer may produce substances that affect brain chemistry, or that the stress of the disease and its physical symptoms can trigger these changes. Imagine feeling overwhelmed by a profound sadness for no clear reason or a constant anxiety that prevents you from functioning. The Pancreatic Cancer Action Network has highlighted depression as an unusual but important symptom in many patients with pancreatic cancer. If you or someone you know experiences a drastic and persistent change in mood or personality without an apparent cause, Do not dismiss it as just depression. It could be a cry for help from the body. The mind and body are intrinsically connected, and sometimes physical illnesses manifest through psychological symptoms. If this connection seems the most impactful to you, write mind body connection in the comments. Dear friends of Nutrients Med, we have unveiled 8 symptoms that, while surprising, are vital for the early detection of pancreatic cancer. From the subtle change in skin color and stools, to unexplained weight loss and persistent digestive problems, to the onset of diabetes, radiating pain, blood clots, and even profound changes in mood. Each of these signs individually may seem harmless, but when they appear in combination or persist without explanation, they are your body's language asking